out tonight. I appreciate you being here on this wet and rainy Monday night. We needed the rain. And with that, we'll go ahead and get started. If you will, join me in prayer, please. Our Heavenly Father, we thank you for all the blessings you've given us and all the joys we have been allowed to partake in life. Lord, you know my mouth, you know my heart. You know sometimes they just ain't in sync. I pray that they will be tonight, and I pray that everyone that comes before us tonight and speaks will speak from the heart and deliver a message that we all need to hear. Thank you for everything you do for us. God bless our county, God bless our state, and bless our country. In Jesus' name we pray, amen. Amen. If you will, join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item of business is approval of the agenda, and I've been told that we're going to pull item number 9. Item number 9 will be pulled from the agenda tonight. And do I hear a motion to approve the agenda as corrected?
Mr. Chairman, could we have this pull and have some discussion on item number 4, the paid parental leave?
Yes, sir. And you want to make a motion to pull item 4 from the consent agenda and put it on the regular agenda. Is that correct?
Yes, sir. Thank you.
Thank you. Do I hear a second? Second. All those in favor signify by saying aye. Aye. All those opposed likewise. The ayes have it. Motion carries. Now, call for approval of the agenda as we have corrected it. Do I hear a motion to approve?
So moved.
I have a motion. Do I hear a second?
Second.
Any discussion? If not, we'll go to the vote. All those in favor signify by saying aye.
Aye.
All those opposed likewise. Ayes have it. Motion carries. Our first item of business is our consent agenda minus item 4. Do I hear a motion on the consent agenda?
Mr. Chairman. Go ahead.
Oh, excuse me. Mr. Chairman, can I just check one more thing here? The agenda I'm looking at, and I know we just went through a process, but I thought it was also going to be removed from the agenda prior to tonight. Item number 6 in my book, unless the agenda's been updated since then.
Now, you're referring to the service agreement between Granville County and Southern Software.
Yeah, and isn't that regarding Eagle Eye? Is it not?
No.
Okay, then, my
Okay.
fault, yeah.
Okay. Thank you. Now, we had a motion and a second to approve the agenda as corrected. Is there any further discussion on the motion? If not, we'll go to the vote. All those in favor signify by saying aye.
Aye.
All those opposed likewise. Ayes have it. Motion carries. The next item on our agenda will be our paid parental leave. Item 4, since it was pulled from the consent agenda, we will address this item first. And anybody got any questions on it? Or
Mr. Chairman, I just a couple. I see the 6 counties, and I'm assuming this is a comprehensive list. Is that 6 out of 100 counties doing this now in North Carolina?
No, that's just the ones that are nearby.
Do we know how many total counties have this in the state?
I'm not sure.
and Pardon me?
What did you say? I didn't hear you.
I said that we don't have a total number of those in the state that are participating in the paid parental leave policy.
So,
My only other question might be, with having the opportunity for adoptions and all the other things, that group could be a larger group. Do we have plans in case there are multiple people in a small department seeking that leave for that extended time, and what impact that would have on providing service?
One thing I would point out, and of course that is a possibility, right? But in all likelihood, somebody who has a baby is going to take some leave anyway, right? Regardless of whether it's paid leave or not, they're going to need a few weeks off. And so really, I think the import of this policy question is whether we would allow 6 weeks of that leave to be paid leave or not. But of course, you're right. There is an operational impact anytime anybody is out, and we have to figure out how to compensate for that.
Does this include, if an employee's wife, but she doesn't work for the county, he can take sick leave too, I mean, maternity leave too?
Yes, so any parent of a new child would be entitled to take paid parental leave.
You can't distinguish between the two in terms of allowing leave under, if you grant it to one, you have to grant it to both sexes. It's the way the law is. I'm not saying it is logical, but that's the way the law is.
Is this the same, what did they have, like 6 weeks or 12 weeks?
No, I'm just saying that if you offer the benefit to one, it would be considered sex discrimination not to offer it to the other. If you offer it to a female, you have to offer it to a male as well, unless it is only for medical related conditions. So in other words, if you're offering someone leave to bond with a child or something of that nature that isn't purely medical related to the childbirth, you have to offer it to both to both sexes. And this isn't based on the amount of time that you're required to give, as I understand it. This is what the county is offering to pay people. So I think the Family Medical Leave Act sets I believe it's a 12-week leave period, not paid. And so under the Family Medical Leave Act, both sexes are allowed also, as I understand it, to take leave for the birth of a child. This is just offering paid leave. It would be something above and beyond what you're required to do by law. And if I misstated any of that, HR, let me know, but I think I got that right.
Mr. Chairman, may I ask a quick question?
yes.
So, under the federal guidelines, they get 12 weeks of unpaid leave.
That would be assuming they had it, assuming they'd worked at least a year and hadn't used up the leave on anything else, they would get up to 12 weeks of paid.
This would give them 6 weeks of paid leave.
Right.
Then would they be eligible again for 6 more weeks of unpaid leave?
They could take the full 12 weeks, and for example, if we paid 6 weeks, they might, and they had some sick leave or annual leave saved up, they could use that to make some of the rest of it paid.
Wow.
And take closer to 12 weeks or even the full 12 weeks.
Okay. Should we have a combination of husband and wife that both work for the county? Okay. Let's just, Ms. Miles, you want to step down here?
We did anticipate that. I just want to make sure we get the answer correct.
Ms. Miles, if we have a husband and wife that are both working for the county and she has a child, they both would be eligible for 6 weeks of paid leave.
That's correct.
Would they have to take that at back to back, or could they take that at the same time?
It can be taken at the same time, or they can spread it out over the time. But it has to be taken within a year.
So they have 1 year in which to take their 12 weeks of paid leave.
6 weeks of paid leave.
6 each,
Yes.
so 12 total.
Yes.
Okay, thank you. And they would still have 6 more weeks each of unpaid leave by
they choose
federal
to take that.
by federal guideline, if they choose to do so.
That's correct.
Okay, thank you.
Or they could use their own accrued leave, correct?
Well, yes, or it could be accrued to add to make it 12 full weeks of paid leave if they have that much leave.
For to be eligible, you have to be here 1 year, right?
Correct.
Okay.
Ms. Miles, when you have looked in the surrounding counties, and this is what you're showing us, a lot of those counties that touch us or very close to touching us are already offering that same benefit. Is that correct?
That is correct,
Okay,
yes.
thank you.
I do want to say, unless I'm misreading it, the policy this year says paid parental leave must be completed within 12 weeks of the qualifying event, not within 12 months. I believe that's what the policy says. And unlike the FMLA, intermittent or reduced schedule leave must be fully used within those 12 weeks. So you couldn't, as I understand it, you couldn't stretch it out the way the policy's written beyond the 12-week qualifying event period.
Are you looking at our policy, the length of the paid leave?
I'm looking concurrent with FMLA approved leave down at the bottom of page 34 of the agenda.
That's in regards to FMLA, but in regards to the
Well, it
paid
says-
parental leave.
It says paid parental leave must be completed within 12 weeks of the qualifying event. And unlike FMLA, intermittent or reduced schedule leave must be fully used within those 12 weeks. FMLA leave, I think, can be used after those 12 weeks. I just wanted to clarify that, and if I'm misreading it, please correct me.
That may be a typo or not what we intended.
Correct, that may not be, because the leave time is limited to 6 weeks in a rolling 12-month period. But, okay. Karina, we were correcting that to say that it has to be taken within the 12 weeks?
That was an addition that we made
Okay,
intentionally.
okay.
And the point of making that addition was so that the leave didn't drag on, wasn't available, and they would take a week here, and then 3 months down the road, they're gonna take another week. One that's difficult to track, but also is difficult to manage your departments if that's happening.
So as it's written is correct?
Yes.
So let's make this clear. What we have on our agenda, the way it's written, is the correct version.
That's correct.
Okay,
So the leave will have to be taken within the 12 weeks.
okay. Does anyone else have any questions?
And I guess my only other one, Mr. Chairman, on page 34.
With our approval.
So I think if I'm reading that correctly, if an employee takes advantage of this benefit one time and they have a subsequent child on the next birth, is it that they would not be eligible for the paid leave again?
Within a 12-month period?
No. Well, after that cycle, after that one child is born, would they be eligible for a future child for another paid leave as well?
Yes,
Okay.
If it comes at least 12 months after.
12 months outside of,
Would you?
right.
Mostly it would.
Sure, sure.
Any further questions?
So if I have five children, I get I get 30 weeks off, right?
As long as the birth of those children are at least 12 months apart, yes.
Okay.
At our age, I think we'll pass that. All right. Commissioner Cozart, you got some more comments?
Mr. Chairman, my only biggest unreadiness tonight, I would really feel better getting a comprehensive list of counties in North Carolina who do this, just to be able to see where we would be in comparison to the state. I don't know if there is a particular rush on this, but I just wanted to, that would be my unreadiness.
I concur.
Okay, would you like a motion to table this?
So just a quick Google search, Tony, I found out that the state of North Carolina offers this very similar benefit to all their employees as well.
Yeah.
Not only is it the counties, but the state of North Carolina and the federal government as well.
Commissioner Cozart, are you making a motion to table this until we can get the information, or do you want to move ahead?
I'm fine with the majority of the board, but personally, I would rather hold it. I make that as a motion, Mr. Chairman, to hold it for further review.
I second.
Okay, we have a motion and a second to hold it for further review. Is there any discussion on the motion?
Mr. Chair,
Yes.
did that review take place within now and the next board meeting so we can either make a decision whether the board would like to approve it or not? I guess the question would be, would the information be back by then?
Would you?
So this is going to entail HR reaching out, possibly on the listserv or possibly individually, to request the information. There is not a database that counties are listed or towns are listed who employ this policy because it's an elective policy. So the chances that she'd get responses back and how many she can get back, even given the time frame.
So
Could be limited.
maybe we can make an inquiry of the NCACC. Have we made that inquiry?
No, we have not.
So after a reasonable attempt of trying to ascertain that information and bring back what we can within 30 days, is that reasonable?
Would you be willing to extend it to 60?
I just think it's not to leave it lingering too long and get the answer back that we wanted, then we can make a decisive action at the appropriate time.
Okay, the motion is to
Table for further review. Yes, sir.
and you're not putting a time limit.
I'm good with the, what'd you say, 30 days?
Within a reasonable amount of time between now and the next board meeting. If that's not reasonable, then the county manager can get with the chair and make a further determination. If you're agreeable, Mr.
Yes, sir. Yes, sir.
Okay, we've reached an agreement then. Is there any further discussion on the motion? If not, we'll go to the vote. All in favor of table it, say aye.
Aye.
All those opposed?
No.
We have one no. We have one no or one aye against, and 6-4. So that concludes our vote on this item. It is tabled until another date. And now, next item on our agenda is item 9, and that's item 9 has been pulled. So item 10, and this is for Scott. I think you're going to introduce your new assistant.
Thank you, Chairman Gooch, Granville County Commissioners. I'm delighted to introduce Stephen Blasko as our new Assistant Director of Development Services. Much needed position, which I think y'all funded last year. A little slow to get that going, but we've got a person on board now. Stephen comes from us with over 19 years of public works and project management experience. We hired him from the city of Oxford, where he was Director of Public Works. Prior to that, Stephen worked for as the operations manager for the town of Clayton over in Johnston County. So we're happy and excited to have him on board. He's been with us about 3 weeks now. So far, has done an outstanding job. He's going to really kind of expand our bandwidth and getting some of these critical projects taken care of. Mr. Blasko?
Good evening, everyone. I appreciate the opportunity to serve Granville County. And one thing I found out that most people don't know, that Scott is actually the Energizer Bunny in disguise, because this man is go, go, go. He never stops. And like you said, it's only been 3 weeks, but it's been very exciting so far, and I appreciate the opportunity. Thank you.
Thank you. Does anyone have any questions?
Mr. Chairman, I knew Stephen when he was with the city of Oxford through the hardware store in my business. He always did a good job for the city. Scott's done a good job for the county, and we've got a lot going on. Scott needs help, and I think Stephen will bring that level that Scott expects to the table.
Thank you.
Welcome aboard.
Thank you very much.
Anyone else got anything?
Just like to say welcome. I think it's a real advantageous situation to be working there with Mr. Phillips, and look forward to your service.
I appreciate it. Thank you.
Anyone else have anything? I'd just like to say thank you, welcome aboard, looking forward to working with you. Thank you a lot. And now our next item of business is a presentation by the Granville County Planning Board with the Chairman Michael Turner here to make a presentation. And Barry Baker.
Okay. Chairman Gooch and Commissioners, on behalf of the Granville County Planning Board, greetings. It is indeed a pleasure this evening to appear before you to provide an update on the activities of the Planning Board. So what are the duties and responsibilities of the Planning Board? Next slide. All right. The Planning Board is responsible for studying current conditions and future trends and creating plans to guide the county's physical and social and economical development. The Planning Board also develops and updates comprehensive and related plans, advises the Governing Board, and conducts continuous research, data collection, mapping, and analysis. The Planning Board creates and recommends policies, regulations, and procedures to effectively implement plans. The Planning Board advises the Governing Board on plans of implementation, including review and commenting on ordinance and zoning map changes. And the Planning Board facilitates and coordinates citizen engagements in public hearings and participates in the planning process and performs other related duties that the governing body may direct. Membership and appointments. The Planning Board is made up of 7 county residents, each nominated by a county commissioner and appointed by the Board of County Commissioners. Appointments to the Planning Board are staggered and are 3-year terms. We've had a busy 4 years. In 2021, we had 58 major preliminary subdivision lots that were approved. In 2022, 746 major preliminary subdivisions lots were approved. In 2023, 15 major subdivisions lots were approved. And in 2024, 53 major preliminary subdivision lots were approved, for a total of over a 4-year period of 872 subdivision lots have been approved by the County Planning Board. Next slide. The Planning Board has recommended 7 land use amendments in this time period, including a major rewrite to comply with new state enabling legislation. The board has reviewed and made recommendations on 7 rezoning applications over this period of time as well. Now let's take a look at what's on the horizon for the County Planning Board. What was formerly called Northwest Area Study, you may be more familiar with, is now called the North Falls Lake Area Study, that is being done by the Capital Area Metropolitan Planning Organization, better known by many as CAMPO. It is in the early stages of the phase. The study will be providing land use and transportation recommendations for Granville County from US 158 in Oxford to the southern county lines. The study area also includes a portion of northern Wake and western Franklin counties. The study will include stakeholders' input processes in the late summer, fall of 2025 time period. We anticipate recommendations in the summer of 2026. Another item on the horizon for our board is a well-researched and thought-out recommendation to this board on solar farms. June 2024, I appointed a solar farm review and evaluation subcommittee. With this appointment, I reminded the committee the #1 goal in Granville County, a comprehensive plan approved by this board, is to protect the county's rural atmosphere and conserve agricultural resources as a priority. The board subcommittee has been working on potential solar farm amendments for the last 12 months. Recommended solar farm amendments may touch on increased buffers, wildlife corridors for migration, keeping water sources open for wildlife, and changing fencing requirements to allow small animals to walk under the fences. The recommended ordinance amendments are predicated on the state changing legislation, allowing local governments to change land use regulations if creating possible nonconformities. In the coming months, the board will also monitor the Falls Lake Rules readoption process. This effort is being led by the Upper Neuse River Basin Association, known as UNRBA. The readoption of the rules is an extremely important effort that seeks to change the rules in a technologically and economically feasible manner. Rules from the adoption process will likely be forthcoming with adoption changes in either calendar year 27 or 28. And in closing, before I ask for questions, I want to publicly acknowledge how blessed the planning board is to have the competent experts like Barry Baker, Carlton Thornton, Angela Blunt, and Caitlin Hart, who support all of our efforts in this as we serve the citizens of Granville County. So at this point, I'm going to pause and ask, does anybody have any questions? And I'll be assisted by Barry if there are questions I can't handle. There we go.
Okay. Question?
Yes, sir. Thank you, Mr. Chair. And first of all, Mr. Turner, thank you for your service. Mr. Baker, many of these will be addressed to you. Apologize for not being able to speak to you earlier this week. I've been under the weather. And so some of these questions you may or may not have answers for. You can provide them back to the board at a later date, if you would, sir. Of those lots approved, how many of those lots have, to our knowledge, have actually been completed?
Commissioner, I would say that approximately 30 of them have been finalized. I take that back, probably 45. There was another first phase of one down Enid Road. Okay. So approximately 45, many of those in 2022, as you know, and everyone knows, are in the process of land clearing and developing.
Okay. So we have a lot approved, but we have a lot that haven't launched.
That's correct, yes, sir.
Okay. So with that in mind, just a few things that I've discussed with this board before and just going to make note of here for you, Mr. Baker, Mr. Turner. And if any commissioner has any dissension, please feel free to speak. One is, I think, is it vitally important that we have the appropriate buffers before our community to maintain the rural character of our subdivisions. And I'm hoping that there'll be further review of that, even though I know Bill 765 may create some obstacles. But it's very important to me that when we build out these subdivisions, that the way it's described is that it be buffered well. And so I really want us to hold to that and challenge developers that are not, or find that challenging for them, that we should challenge them. The next matter that I'd like to touch on is that we created a text amendment for a TIA. And so traffic impact analysis that would help us with our traffic. As you well know, and the purpose of that Campo study is that we know we're facing, at these subdivisions built out in the southern end, unprecedented amount of traffic on what are our major corridors, which are considered secondary roads by Campo. And so with that, we've also seen a large amount of individual lot building along our corridors in between housing developments. And so, which creates additional traffic through those corridors, and which each of these corridors, when I talk about Highway 15, 96, 56, and even some major roads like Old Garner Road, Bruce Garner Road, there's no allotment for turning lanes and things of that nature, other than what we would provide through the careful planning with DOT in regards to the development. So what I'm asking is that reassess that based upon the amount of singular lots that go on, the combination of numbers and the increase of numbers, that we at least keep our finger on that. And that recently I went down to the subdivision between Highway 56, Wilton Crossroads and US 1 at the bottom there. Mr. Baker, I think you know what I'm talking about, off Highway 56, between Wilton Crossroads and old Grove Hill Road. We talked about it here recently. I'm concerned based upon the width of that road that's been constructed that it will be, in my estimation, I want to make sure that these roads are all being built out to meet DOT standards, and that we have the mechanism within the county that makes sure that they abide by that. Can you talk to that and give us that assurance that that will occur?
Commissioners, yes, we require a as-built or a built-to-standards letter that prior to signature of a final plat, the DOT provides that. That letter assures that roads are built to standard. That letter also might note some deficiencies, and if it does, then the developer either fixes them or bonds them at 125% of the cost of an engineer's cost estimate.
So do we have the assurances if that occurs and say a contractor for whatever reason doesn't do that and decides they're going to walk away, is there a mechanism in the county that can enforce them to ensure that road that they built met DOT standards, so we don't get lit with what's called an orphan road?
We do have regulations and procedures that since about 2015 that seeks to assure that roads built will be taken over by the DOT. It is something that staff talks about with the developers a lot. It is usually the number one priority. I do want to say that that built to standards letter, if it doesn't note deficiencies, there is no bond in place, but that means the road was built to standard at the beginning. There are, through the county attorney's office, road maintenance responsibilities and things of that nature that gets recorded as well. We work very hard to try to get roads taken over to the standard that was amended in 2015.
And the reason I bring it up, Mr. Baker, and thank you for, I didn't have an opportunity to talk to you before tonight for answering these questions, is that we're an unprecedented, potentially, we could be in who knows what financial situation. These subdivisions were approved, many of them 2.5 years ago. What I don't want to see is that we get in the middle of these phase builds and all of a sudden the right thing doesn't occur, and we end up with a situation within the county that we've had previously. And I want to make sure that we've done all that we can do to ensure that doesn't happen. That's the assurances that I'm looking for.
We do all we can, and I will say that we have a subdivision regulation that says if you record one phase of a subdivision, then before any subsequent phases are recorded, then that first phase or that initial phase or the earlier phase has to be taken over by the DOT before any subsequent phases are done.
All right. Thank you, Mr. Baker. Go ahead.
I was just going to add that so far as I know, at least the last we reviewed it, and we review it when we do subdivisions, we believe we go as far as the law would allow us. One thing that we have to keep in mind is that we're not a municipality that can maintain streets and people. We put subdivision disclosure statements, as I recall, Barry, and make sure I'm telling him correctly. There's subdivision disclosure statements that are required to be filed so that individuals buying, if they do a title search, will understand the nature of the roads.
That's correct.
And so, again, some of this is put on the owner. They're buying in the county. They're not buying in a municipality where there are road maintenance requirements. So there's a bit of buyer beware in terms of some of these requirements, but we do the best we can within what the law allows us to do.
Road maintenance, Mr. Commissioner May, road maintenance and stormwater controls in major subdivisions are very important. And we do all we can to get those things recorded, agreements recorded. And we certainly voice it to developers and later homeowners association members.
And just one last, thank you, Mr. Baker, and board, thank you for allowing me to ask these questions. Mr. B and Mr. J sit and listen to these meetings, and we're not part of the decision-making process, so we like to provide input both to the board and directly to Mr. Baker and Drew when we have the opportunity. Active recreation. And so within our subdivisions, often it's planned the areas in which active recreation, a certain percentage has to be provided by the developer to meet that, so that each community provides the new neighborhood a place where a playground can be something active, not something passive. And so, as I've said before to the planning board, and I'm saying again to you tonight, I am hopeful that we will really look closely at some of these developments that occur, that I think all too often what occurs in my mind, and Mr. Baker, you can say otherwise, it's just from my way of thinking, from my visualization of reviewing a number of plats, that often the builder will find it very easy to place active recreation next to a culvert, a retention pond, somewhere that would be very unattractive, or not somewhere that you could have an active recreation occur within 24, 72 hours after a big rain event. So I'm really hoping that as you review the plans, and the board can correct me on this, I think it's the intent of this board when we came up with that directive, and Commissioner Kieran, you can speak to it well, you're a very big part of that part of it was that we created a recreation fee that would go to county recreation for each home. And the other was that we would create active recreation within each community that was not in the most less than opportune location within the development. In other words, not something all the way around it, or just happen to be this culvert or near that culvert, but something like an area that generally would understood that you could actually do active recreation. And I'm concerned that sometimes our developers like to thread the needle there, and I prefer that we have much more scrutiny in regards to that. Thank you, and again, thank you, board.
Mr. Chairman, I have
Yes.
Mr. Baker and Mr. Turner, you touched on the solar farm issue, and that seems to be somewhat of a hot topic going on now, that we have several looking at the northern end of the county. Are you looking at doing setbacks along Commissioner May's line of thought for developers? Are we looking at setbacks and buffer zones around the possibility of the solar farms that are possibly coming? And if they do, there'll be more applications probably to follow.
Commissioner Williford, that's a good question. The subcommittee that's been looking at solar farms will be, I feel, making a recommendation for increased buffers. As you know, solar farms go through the conditional zoning process. I will tell you that because of the state law, we haven't brought forward regulations at this point, but it has been communicated to those that may be bringing, and we do have one that's coming to the planning board in July. They had a community meeting. It's on Satterwhite Road, proposed. They had a community meeting. They showed quite extensive setback from Satterwhite, and they showed corridors. The reason I say that is that developers in that process can come in with conditions stricter than what the ordinance has. if they put it in writing. And so I've voiced that to about 3 different groups. But yes, I mean, I think that there is some going to be recommendations. I can't tell you what that will be because it hadn't been finalized. But we still have that process that can try to get more than what the regulation says currently. And staff starts that when we talk to them initially. And I've been asked, or staff has been asked, what are some of those recommendations likely from the Solar Farm Subcommittee, and I've advised them what I think they are.
Are we able, and I know the state has some Senate bills and House bills that may take some of that away from the counties. Are we able to limit the size of any of these to acreage at this point?
That is a very good question. The answer to that is you potentially can. I don't know of anything at this point, and Attorney Wren may know of something that's at the General Assembly at this point. You potentially can. What we're told is at this point in time, the 50 acre that we have seen in the past is a thing of the past, or at least at this juncture, the next 10 years, that these sites are large. 400 acres is what the one that is coming to the planning board. I have heard of 700 and 800. It is, and I'm glad that it is a conditional zoning district process. They can come in with what they believe is the perfect plan, and if the community is against it and voices it, it doesn't have to be approved. Now, that's under current regulation. I'm not sure what the state may do in the future.
Thank you.
I'd like to add a comment to that, if you don't mind.
Yes, sir.
When I opened in my remarks, one of the charges was that we protect the county's rural atmosphere. So when I charged the committee with this responsibility, I told them to take their time and do a thorough job, because the recommendation that's coming to this board, we don't want it to get turned over. We want to do a thorough job and give you the best recommendation that we have. So they were charged with becoming knowledgeable with House bills. No need to read the numbers, but competitive energy solutions for North Carolina, energy solutions that have been adopted since 2021, agricultural support enterprises, conditional zoning, and buffer between zoning districts. Paying special attention to the buffer density, solar farm acreage, types of shrubs, landscaping, use of fruit and nut trees, wildlife, glare, visibility, impact on wildlife, berm size and height, animal-friendly fencing that I mentioned earlier, slatting, noise pollution corridors, natural water resources, rules on clear-cutting timber, stormwater runoff, and best management practices throughout the region of solar farms. I also asked them they reach out to several people in the state government or North Carolina University, North Carolina Solar Center, Sustainable Energy Systems and Policies, North Carolina Wildlife Commission, to gather as much information and again, take as much time as you need to do this, because we want it to be thorough when we make a recommendation to this board.
Thank you, Mr. Turner. Thank you, Mr. Baker.
So, Mr. Chairman, if I may. There's a lot to unpack. I've got about 45 comments, but I'll try to make it 3. So the Northern Falls Lake Area Study, it's interesting to me to see that the traffic impact analysis is reaching into northern Wake County, especially in my district in the southern end. I know that there is a spot improvement possibly on the horizon for the, let's see what the road is called. It's, Six Forks and New Light.
Right, New Light,
98.
turns into Bruce Garner, yeah.
So, yeah, we go, what Mike just said, Bruce Garner becomes. But so that intersection, I understand because of the Northern Falls Lake area study with Campo is being looked at for possibly what they're calling a super intersection. So that's one thing that's coming up. I think it all should be on our radar. So apparently that's faster lefts and rights, but I'm not 100% sure on what a super intersection is. But apparently it's supposed to make the fact that when you get in that traffic line and you see the intersection and you have to wait 8 signal changes before you can get through it, it's supposed to speed that up. So I think that would be one thing as we look at growth in the southern end, that we increase the distance for our traffic impact analysis, because those downstream clogging effects have got a huge stranglehold on what we can do here in Granville County. The next thing I've got around recreation, excited that we've got the per lots subdivision charges that are going to go into the bank, so to speak, for those active recreation spaces. But I'm like Commissioner May, that these developers need to have their feet put to the fire on utilizing good land for active recreation space, instead of trying to say that, like, oh, this storm catch basin, which has got like a BMP on it, best management practices for stormwater control, is the recreation for the neighborhood. So we need to make sure we don't let them double count those areas. Another thing that I would like y'all to make sure you have on your radar is the CBUs, or the mail kiosks. The Postal Service, and Mr. Griffin could probably speak to this better than anybody on the board, but the Postal Service doesn't do door-to-door delivery in new subdivisions anymore because of the amount of resources that it takes, and the amount of stopping and starting and all the other things. So they've got these, community mailboxes, with, whether it's 10 or 150 mailboxes in one location, that we've got adequate pull-offs or parking spaces for those. The mail carriers' safety and security is one thing that we need to take into consideration as well in that. I know in smaller subdivisions, they try and stick them into like people's yards so that like dog bite incidence is still high. But, you get some subdivisions that have got, 100 of them at one point, and they're all usually located slightly askew from the rest of the neighborhood, usually centrally located gathering point. I know that's actually going to become possibly an interface for the community when they all stop by between 4 and 6 to get their mail at the same exact spot. So one would hope that they can either walk there or have, if they do drive, that they have got a parking for their vehicle instead of just pulling off into the ditch. That could become a traffic impediment for other people that are trying to get home at that, those mass, let's say rush hour times, for lack of a better word. But when you've got a couple 100 lot subdivision and everybody's coming home from work between, 4:30 and 6:30 in the evening, and they all want to stop and check their mail, and there's, a backlog of folks, that we've got adequate, because we don't want the roads getting trashed. If everybody's pulling off onto the shoulder, soft shoulder, and with the downstream effect of that. So I know that that's one thing that we probably want to have in mind for the CBUs. It's an issue in some of the smaller communities, and I think it's probably going to become an issue for us here in Granville County as these subdivisions come online. It's not something normally that the plan review probably takes into consideration when they're looking at those subdivisions. I mean, like a lighting package, you know what I mean? It's one of those afterthoughts kind of thing. So this mail thing is, I think, one of the next big thing that's going to really bite us. So I just, again, want to mention those couple things, and especially on the recreation front, to make sure that we're having usable land instead of where they want to stick it. So that's my comments. Thank you.
Does anyone else have any comments, questions, concerns?
Thank y'all commissioners for your comments, and we certainly have, we've made our list, and I would say that please be involved in that North Falls Lake area study when you have opportunities to provide input.
Thank you.
The land use component is being done now and will be first, and then the transportation part of it.
All right. Mike, you have anything else to say?
I do not. Thank you for the
thank you.
comments and feedback. We appreciate that.
Thank you. We appreciate it.
Yes, sir.
Thank you both. Appreciate your presentation. Appreciate you addressing the questions and concerns. Our next item of business tonight is public comments. We didn't have anyone sign up for the public comments, so we move on to public health matters. A resolution to direct expenditure of opioid settlement funds, NC Harm Reduction Coalition. And this is on page 118 of our agenda. And yes, Kathy Hazlett is here to make the presentation.
Good evening, Commissioners, and thank you. My name is Kathy Hazlett. I am the Substance Use Prevention and Treatment Program Manager for Granville Vance Public Health. I am also the Opioid Settlement Program Manager for the Granville County, helping to facilitate the use of the opioid settlement funds. And at our May Opioid Advisory Committee meeting, the members of that committee unanimously recommended to all of you, the board, to fund the North Carolina Harm Reduction Coalition for $50,000 to implement a very comprehensive harm reduction strategy for the county. This falls under Strategy 9, I believe it is, Syringe Services Program, but it's much more than syringe services. And I have Elise Powell, who's the Executive Director of North Carolina Harm Reduction, Kim McMahon, who is a harm reduction outreach specialist for both Vance and Granville County. Jessica Sharon is here from Vance Recovery Services, who is a licensed clinical addiction specialist. And I noticed that Dr. Morris and Dr. Shauna Guthrie are both in the audience to answer any questions that you may have specifically about the benefits of harm reduction on substance use. As way of introduction, I wanted to start with a short presentation about harm reduction so we all understand what it is, and I think I'm going to do this right. So the Opioid Advisory Committee very early in our this current fiscal year developed both a vision and a mission statement, and I'm going to read those out loud because I think it fits very nicely for what we are trying to do overall with our opioid settlement funds. The vision is to be a thriving, unified community where every member has access to the resources, education, and support needed to prevent and overcome substance use challenges while fostering a healthier, more resilient future for all. So that is what we're striving for. Our mission is to combat the opioid crisis in Granville County by using evidence-based strategies to increase access to care, support recovery, and raise public awareness. Through collaboration and healthcare providers and communities, we aim to empower individuals to overcome addiction and build a healthier, more resilient society. And harm reduction is very much a part of that. And this slide basically shares that we do harm reduction every day, whether it's wearing a seatbelt or putting on sunscreen. Harm reduction is with us in a regular part of how we keep ourselves safe and prevent disease, spread of disease and harm. What is harm reduction, though, according to the National Harm Reduction Coalition, is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. And a few of the key principles, and there are a number of principles of the National Harm Reduction Coalition, but I think these are some of the key ones. The harm reduction does not attempt to minimize or ignore the real and tragic harm and danger associated with illicit drug use. It understands drug use as a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence. And it also affirms people who use drugs themselves as the primary agents of reducing the harms of their drug use, and seeks to empower people who use drugs to share information and support each other in the strategies which meet their actual conditions of use. And as I begin my second year in this role, one of my intents is to conduct some focus groups with people who are using drugs to help us define and share ways that we could improve upon reducing overdoses in Granville County and certainly bring the rate of fatal overdoses down significantly. The next slide does share, and it just simply gives you an overview that overdoses happen everywhere in Granville County. And mind you, while these are 911 reported overdose calls, the actual number of overdoses is significantly higher because many, many are never reported. The information regarding the number of overdoses that are happening in Granville County, sadly, are going up. So that tells us that we need to be much more active in making harm reduction, naloxone specifically, more available to people so that we can prevent overdoses from happening in the first place. This next slide shares data from the Office of Chief Medical Examiner that shares information that, in fact, opioid overdose fatalities are decreasing. So while our overdoses may be increasing, the fatalities are decreasing. And I think that's in large part to the availability and accessibility of naloxone. And sharing information, for example, of Never Use Alone. There's a phone number that we are making available to people so that they know to call, so that if they are using drugs alone, they have someone on that phone line who can call 911 and get help immediately. Stigma is a real barrier to treatment, and I've been trying to do a lot of education around harm reduction and stigma, so people understand that when people feel ashamed of their use of drugs, they're less likely to seek treatment. We need to help people understand that a substance use disorder, whether it's an opioid disorder, an alcohol use disorder, a nicotine use disorder, is frankly a chronic condition of the brain. And we need to provide help and provide that medical service just like we treat any other medical condition. Compassion can go a long way. And then finally, understanding that harm reduction is part of the national strategy to reduce opioid overdoses. It's also part of the state strategy. And then finally, just indicating that harm reduction is all about saving lives and preventing spread of disease. So I'm hoping that you will support the idea of harm reduction. And I'm going to let Elise and Kim stand up and share more about their proposal. Thank you. I'm just gonna.
Thank you so much. And Mr. Chairman and board, thank you so much for taking the time and having us here. My name is Dr. Elise Powell. I am the Executive Director of the North Carolina Harm Reduction Coalition. And I'll just share on top of the wonderful presentation that Kathy just gave that while my face may be new, we've actually been friends for a long time. So we have been operating here in Granville County since 2015. We originally partnered on the Rural Opioid Overdose Reversal Grant with y'all and have enjoyed a really long and productive partnership here. So what we're proposing with this is really to try and continue and build on the good work we already have going on in the county. Last year, in part due to the incredible work of my colleague Kim here, who is a one-woman show, we served over 160 people, distributed over 600 naloxone kits in your county, and connected over 67 people to other wraparound services and care. So that means people were connected to housing supports, transportation supports, domestic violence crisis services, whatever it was that they needed in that moment. We were the open door they could walk through, the place that they could raise their hand and say, hey, I think I need some support, and we can start a conversation about their health. So that's really what we're starting to do here. We've really loved working in this county and supporting its residents. But the reality is, even though, as Kathy mentioned, overdoses are going down, they are still dramatically higher than they were even at the beginning of the COVID pandemic. So we're still at a really high level. And so we've hit a point where the demands for our services have simply outstripped our capacity, right? We just need to invest in order to continue to maintain access to the life-saving medication naloxone, like Kathy mentioned, continue to provide those wraparound services, and really be able to support more of Kim's time in making our services more available to folks. We're also proposing offering free naloxone and naloxone training to community partners who desire it. We actually do naloxone training for law enforcement officers, for public servants, for libraries, for anyone who may want it in the community. And so that is an additional benefit we can bring if this proposal is accepted. So we'll just say thank you so much for your time. Thank you, Kathy and team, for the support. And I'll pass it to my colleague Kim if she wants to say anything.
No, I don't want to.
Okay, she's shy today.
Thank
you so much.
All right. Does anyone have any questions, any comments?
Yes. To your surprise, I'm sure. Ms. Haslett. Let's see, the $50,000 this is going to syringe exchange program.
Yes.
Can you explain how that works?
Well, it's a combination. So the funding is going to support the Harm Reduction Coalition. Syringes is just one supply that they will be providing. It's naloxone, it's condoms, it's sterile water, it's test strips. It's a wide variety. So the strategy is referred to that syringe service program, but it's much more than providing clean syringes.
So I would, and I say this with respect, please don't read into anything I say. And if I say something that sounds offensive, just tell me it sounds offensive and I'll apologize. But I have a moral issue with exchanging a needle to a drug addict to use that needle to administer drugs. And I did a lot of research and on this matter when this came to my attention. And in the course of North Carolina, they're no longer considered drug paraphernalia, but it's in fact is if they're actually registered with the program, they can't be charged criminally. Am I correct?
Yeah, they cannot be charged.
Okay, has anyone gone and talked to, besides the sheriff, because I know the sheriff's very aware of these programs, but to any of our local law enforcement agencies and the district attorney and the judiciary to see how they view this program?
Do you want to comment?
Yeah, sure. So thank you so much for the question. First of all, I'll just share that I understand the hesitation, right? When we first explain these programs, they're like, what do you mean? You're giving out syringes, et cetera. So I'll just share that this is a strategy that has been around for decades, and decades of research have shown that people who engage in these services are 5 times more likely to enter treatment and 3 times more likely to stop drug use completely. Please don't hold this against me, but I used to work for the state, and in my career there, I never saw numbers that effective, right? So this is really unusual in terms of success and engagement. In terms of law enforcement, yes, actually, we have an entire law enforcement team composed of current and former law enforcement officials. We have had law enforcement as partners for close to 15 years at this point. And actually, in one of our more recent projects, we had over 8 different law enforcement agencies, including your neighbors at the Vance County Sheriff's Office, write letters of support and endorsement of these strategies. So yes, we have engaged with law enforcement partners. I can't say we specifically have spoken to your Oxford PD, but we have in neighboring counties as well as judges.
So we're doing a program here in Granville County, and that, for me, I'd like to know that our law enforcement and what our judiciary mindset is, because they're going to be encountering these folks.
Yeah.
And so it's 2 a.m. They encounter someone that, and they want to write a citation or whatever they do for someone with drug paraphernalia. And I guess the person has a card
That's right, they have.
Right, so if the person doesn't have the card, who does law enforcement get in touch with? What do they do?
So great question. So first, I'll just acknowledge that, like I said, we've been operating here for 10 years. So, right, we've already been working these incidents out. I've never heard of an incident that was an issue. You know, y'all correct me if I'm wrong, but I think we've been working fairly well together over the last decade. But to answer your specific question in terms of what would happen, so keep in mind, these items are still paraphernalia. It's just the card that provides a limited immunity if they got it from an SSP. So what they could do is say, okay, contact us, and we could verify yes or no, this person is a participant of our program, right, to help inform the officer on whether a charge is appropriate.
Okay, thank you for that. So I just got a few more questions here, if you'll allow me.
Mr. Commissioner, can I just add one more thing about
Sure.
syringes? So the other important role that a clean syringe provides is the prevention of transmission of disease. So we're trying to also bring down the hepatitis C rate. And the way we do that is the provision of clean syringes. So I just want to.
So I did read the information that the doctor talked about, but I've also read other information that says that they really can't qualify. That is showing a real drug reduction. And actually, some of those comments came from CDC and the National Institute of Health. So it's not universal that they show that impact. So my next question to you is that, what about addressing it from what it doesn't do, it doesn't address it from a root cause addiction. It diverts funding from rehabilitation, abstinence programs. And it normalizes drug use, potentially leading to greater acceptance of addiction. So are we engaged at all with any faith-based communities here through these programs to help work on abstinence?
Right now, abstinence-based is not considered evidence-based. We have to work with what is evidence-based. That's what's required of the memorandum of agreement. Right. So, and just to understand that what we're talking about, we're not just focusing on syringes, we're talking about a wide variety of harm reduction. So what has been proven is the increased accessibility of naloxone, which is a big part of this program.
Thank you for your information. I just wanted to get some clarity on a few issues, and I hope that, again, through reading through your proposal, that we are working on a means to provide more counseling opportunities and more addiction prevention opportunities through the health department on the southern end of the county. We have no brick and mortar on the southern end of the county. I don't even know if we have a mobile unit that goes to southern. I know we have a paramedic program, our new program that you got through Granville Health, which is very good. But again, a large population lives in southern Granville. I'm sure if that's a countywide issue, it needs to be addressed countywide. And so I'd like to see this become a more countywide based program and not a centric to one municipality.
Absolutely, totally agree with that. The one thing to point out is, sadly, the opioid settlement strategies do not include prevention. It is all abatement, treatment, recovery oriented. So I wish it was focused more on
But isn't that what you're doing? You're preventing communicable diseases?
Well, in that regard,
right?
but you were talking about the underlying cause,
Okay, got
right?
it. Well, listen, I appreciate your work. Again, just it's hard for me to be convinced that exchanging a needle to a user who already isn't seeking coherent will make the right decision the second time around.
I should also add that while, in addition to all these harm reduction supplies, the North Carolina Harm Reduction Coalition will have our list of substance treatment providers to be distributed, as well as this resource card that we have created both in English and Spanish that provide the 988 number, the never use alone number, so resources to help people.
I'm appreciative of what the Opioid Board does, what you do. I want to make that clear, and I don't want to make this sound territorial at all, but it will sound that way. But I just want to know what happens to the attic on Grove Hill Road. How are they going to get that information? They have no contact with Oxford, very little contact with Creedmoor. How are these folks going to get this information?
Well, the point of working with the Harm Reduction Coalition is they will be throughout the county. So maybe, Elise, do you want to say more about that?
Yeah,
Thank you so much for the question. I think that's actually a perfect example. So we are countywide, and right, we are not the full continuum of services, right? We are not the amazing treatment providers in this room. We are not the various pathways that people take to recovery. What we are is an open door. We are oftentimes the first point of contact that that person who you said, who's standing on the sidewalk in southern Granville County, right? Like, we do mobile outreach. We start those conversations to say, let's start a conversation about your health. Sometimes it can be as simple as, okay, let's start taking care of your skin first. And as they start to build that autonomy and sort of agency to say, like, okay, I can take care of my health. Maybe I do want to be, invested in a recovery program, whatever that pathway is. So it's such a great question. I really think it's an important point, and that's exactly what we're here to do.
And I guess we're going to somehow or another be working through this process, understanding that funding may not be available through the opioid, but maybe through grants committee, but maybe through grants on getting a means of transportation for folks that otherwise aren't living near the municipalities where they can get to the, for example, Visions or the health department. We're working on that.
Yeah, I can't speak to this county in particular, but I can say that NCHRC in other counties has developed models, for example, working with things like Uber health contracts and other transportation providers to sort of help folks. Our team also sometimes provides transportation, as the case may be, but when I say referrals to care, we know we're providing numbers, but it's often a lot more than that, right? It's really saying, like, okay, we're gonna get you to your appointment. We're gonna get you where you need to go. So, I can't say.
I'm reading some stuff on KARTS, so I think maybe that's a possibility there. But I'm just wondering, what are the plans for that? What are the plans to deal with that?
For mobile.
To help those folks that are not near a municipality. I mean, I'm pretty confident that drug addiction is just not centric to municipalities.
Right. Oh, absolutely. Absolutely. And I think that's another part of what the coalition's proposal is to work with a peer-to-peer network of folks because it's people who use drugs who know people who use drugs. And so they can help one another to be accessing the services to keep them alive, to keep them safe. And the longer someone stays alive, the better the chances are that somebody's going to get to treatment eventually.
Well, you're pretty good at finding grants. Maybe you can help with a grant to be able to expand transportation so we can get, and working with VIA to be able to get some additional transportation for these folks throughout the county.
I would love to do that. And housing too.
Okay. Anyone else have any questions?
I just want to say, Ms. Hazelwood, join you in this whole challenge of getting people past the stigma of coming forth and reaching out to someone when they have a problem. If there are any strategies that, we can use in the community, I'm sure there are churches and other civic groups in a way they can work together to try to help people get past that, because it literally could save their life.
Absolutely.
Thank
It does take a village, there's no question.
Thank you.
Does anyone else have any questions, any comments? Well, thank you. We appreciate the presentation. And now, funding is available in the Granville County Settlement Grant Project Ordinance. The Opioid Advisory Committee recommends that the Board of Commissioners approve the resolution to direct expenditures of opioid settlement funding in the amount of $50,000 to support syringes services program implemented by the NC Harm Reduction Coalition, and authorize the county attorney to draft a subsequent agreement with the NC Harm Reduction Coalition. Is there any further questions from anyone on the board? Then we'll entertain a motion.
Mr. Chairman, I'll make that motion that we approve the $50,000.
Thank you, Commissioner Wilford. Do I hear a second? I have a second. Is there any questions on the motion? Hearing none, we'll go to the vote. All those in favor signify by saying aye.
Aye.
All those opposed?
Aye.
We have we have a majority that have voted aye. Motion carries. Our next item of business is planning matters, a text amendment for minor deviations and by our Mr. Barry Baker. Thank you. And the purpose of this is, the purpose for this legislative hearing is to hear public comments regarding a proposed land development code text amendment pertaining to allowing the planning director to approve minor deviations to approve major and minor special use permits if the deviation meets the criteria established by the amendment. And now I want to declare the public hearing open. At this time, I'd like to recognize Barry Baker, our planning director, for a brief overview.
Thank you, Mr. Chairman, commissioners, ladies and gentlemen. I want to state that all public notice as required by local and state law have been accomplished for tonight's hearing. As the chairman mentioned, this is an amendment to the Land Development Code that would allow the planning director to approve minor deviations to approve major and minor special use permits if the deviation meets the criteria established by the amendment. Those include driveway relocations, structure floor plan revisions, facility design modifications for amenities and other site features, minor adjustments to road configuration or internal circulation, or minor adjustment to building location, landscaping, lot configuration, and or utility alignment. The code amendment minor deviations would not allow changes in use permitted or the density of overall development permitted. The deviations must comply with underlying zoning standards and other applicable conditions of approval and has no material effect on character of the approved development of any approved condition. I want to state, as in the cover sheet, this amendment came about based on communication from a telecommunication applicant that the NCDOT required a change in the location of a driveway that was shown on a recently approved major special use permit by the Board of Commissioners. And having researched the issue with the county attorney's office, it was found that staff does not currently have the ability to approve minor deviations to approve major or minor special use permits. As such, even minor deviations would need to go back through the special use process for slight changes. With the assistance of the county attorney's office, planning has modeled the proposed amendment after the town of Butner's ordinance. The planning board at their May meeting recommended approval 4-0, and their planning consistency statement reads, the Granville County Comprehensive Plan is silent in respect to this amendment. However, the planning board believes the amendment is a reasonable and consistent effort to facilitate development proposals that have gone through the hearing and approval process, but have found the need for minor changes due to a higher level government requirement or unforeseen site-specific issues at properties approved for major or minor special use permits. And again, the planning board on May 15th, by a 4-0 vote, recommended approval. I'd be happy to answer any questions.
Thank you. Thank you, Mr. Baker. And we didn't have anyone sign up for comments at the public hearing, so therefore we'll move on to the board. Does anyone on the board have any questions? Hearing none, we will declare the public hearing closed. Thank you. The planning board recommended approval of the proposed land development code amendment by a 4-0 unanimous vote. Please note that the North Carolina General Assembly has enacted planning legislation concerning governing bodies' statements pertaining to plan consistency and reasonableness in regard to land development code amendments. North Carolina General Statute 160D-605. In that regard, the board may accept the planning board's plan consistency and reasonableness statement as their own, prepare a different statement. what is the pleasure of the board?
Mr. Chairman, I offer a motion to approve the recommendation from our planning director around these staff level changes.
Thank you. We have a motion. Do I hear a second?
Second.
We have a second. Is there any discussion on the motion? If not, we'll move to the vote. All those in favor signify by saying aye.
Aye.
All those opposed? Have no opposition. Motion carries unanimously. And thank you. Thank you, Mr. Baker. And now we have our Cityscape agreement renewal. We get straightened out here. The Cityscape telecommunication agreement needs to be renewed. The current agreement includes consultant review of new towers for federal, state, and local compliance, antenna coalition review for regulation compliance, and site management services regarding county-owned towers that includes site leasing with telecommunication companies in efforts to pursue coalition tenants for the county's towers, infrastructure, Wilton Tower site, and Oak Hill Tower site. The proposed agreement will be for 3 years from the time of execution. And Granville County has contracted with Cityscape since about 2009 for services that include new tower review, antenna review, and site management services. Cityscape has provided 2 draft agreements, one that would include site management services, and that would provide new tower review services only. Mr. Baker, you got anything to say on this?
Yes, sir, Mr. Chairman, Commissioners. After careful consideration of the 2 lease agreements, I would recommend that Cityscape continue to provide new tower and co-location review. Regarding the review services, the new tower fee is proposed at $6,500. That is paid, all these fees on this slide are paid by the telecommunication company. It's put on deposit with the county, and once the review occurs and is finalized, Cityscape is paid the amount. In regard to new towers, that occurs after the major special use hearing. In regard to co-locations, that occurs when they have made a report. In regard to co-locations, they look at loading to make sure that towers are not overloaded, thus potentially causing a fall danger. The only fee that is proposed to go up would be a non-eligible co-location from $4,000 to $5,000. I can say that since this has been part of the agreement, we have not had any proposal like that, but what that includes are existing facilities that might be have the height of the tower increased, or the size of the equipment compound beyond the state minimums that are allowed without having to go through that process. Again, the fees are paid by telecommunication applicants. The site management, if the commissioners are of a mind to have that, would be lease negotiations, draft of new leases, tenant coordination of new leases, upgrade and modification, leasing review, lease amendments, tenant agreement amendments, revenue collections and projections, revenue verification, and issue resolution. Again, I would recommend that the county continue with Cityscape to provide the new tower and co-location reviews. We have 2 sites that the county owns. We have Oak Hill in the northern part of the county, and then the Wilton site at Wilton School, at the Wilton EMS station. The last time that a tenant, a cell company, went on one of the sites was in 2014. Two of the three went on in 08 and 09. The Oak Hill site is pretty close. Also has State Highway Patrol antennas on it. Also has Channel 4 or public PBS antennas on it. It is pretty close to having its being at its maximum load. The other one, Wilton, has Verizon. They are the current tenant. Those are the facilities that the county owns that are towers, that are high structures. What I would say is that when new towers are proposed, both staff and the consultant work with review in a pre-application meeting with the cell companies. We look at are there county-owned properties in the search rings. So that process happens. If they do, then they would be directed to that because they are higher in the hierarchy. We also make sure that there aren't structures that are there that might be. There aren't that many high structures, but there are some that someone may co-locate on, and that's higher in the hierarchy. And I would say that when we make someone aware that there's a co-location possibility, they co-locate. And again, no lease has been entered into since 2014. If the site management services are what are approved, 22.5% of the new lease rents would go to Cityscape for their service. They also propose 15% of gross for renewals or amendments to leases. Amendments to leases can occur when, take for instance, Verizon wants to put new antennas on the Wilton site. If they increase the load, then the county certainly may ask, unless it's bound by a contract for increased rent. So they would handle that with 15% of the increase lease amount, 5% for existing fees collected at any time after the effective date of the agreement in force. I recommend approving the agreement that would allow Cityscape to review new towers and antenna co-locations subject to review by the county attorney's office. I do think that that the time is passed for those site management services, and that going forward, as y'all know, they do a wonderful job with new tower during the major special use process. They do the same with co-locations. There are provisions that if the county wanted to utilize their services for a special project, they would be able to do that. Y'all would have to approve it. They put in what their hourly rates would. The last time that was utilized was probably 12 years ago when they looked at some ordinance amendments that we were proposing. I'd be happy to answer any questions.
Okay, has anyone got any
I
questions?
have one quick question, Mr. Baker.
Yes, sir.
While we were talking, you were talking, does the county receive any benefit tax revenue wise when there's a tower on a piece of property? What is the tax revenue benefit? It increases the value of that parcel?
I'm not sure what that would increase the value.
Right.
But if it's on a county-owned property, the county would receive the lease. The three tenants that are on county towers now, Two of them are in the third period term of each one is a 5-year term, so they're in the third 5-year term. The other one is the second of the 5-year term. I'm not sure what increase. I don't know that those towers provide appreciable property tax benefit, but if it is on county property or it can be on school property.
Hard to know. I would say my guess is that an acre or two with a tower on it is probably worth something more from a tax value perspective than just open land.
I think the one in Oak Hill is on the county's property.
Does anyone else have any questions?
Thank you, Mr. Chairman. Just out of curiosity, I was looking at number 7 on page 142, and it dawned on me just to ask, who is the state governing authority over these towers? Who looks after the work Cityscape would do in this situation? Is there a monitoring entity from the state who comes out and does any kind of announced or unannounced monitoring of the towers?
There really, Commissioner Cozart, isn't a body a state entity that oversees what a consultant does, nor what our regulations are. They have to meet the building code. And there are codes associated with wind, ice, load, electricity. So there are building codes that are applicable to them. It's a federal law, the Telecommunications Act of 1996. Basically, you have to stay within the parameters of that federal law. And basically, you can't discriminate between carriers. Those are generally what the rules are. There are some state rules, like if you don't increase the height by 20% of a tower, it can be administrative, or 20% of the ground compound, it's administrative. But pretty much you have to stay within the parameters of the law.
And you're pretty much that authority who looks after to make sure they do your office, basically.
Yes, sir.
Okay.
And they provide a valuable service to Granville County in their review of new tower applications. They answer questions that local planning staff don't know.
Gotcha. Thank you, sir.
Any further questions? Anyone else? Hearing no other questions, it's the recommendation that we approve the agreement that would allow Cityscape to review the new towers and antenna co-locations. There is one new tower proposal that will need consultant review, as well as one antenna co-location needing consultant review as of June 5th, 2025. If the county would like to pursue site management services, the county can approve the attached agreement that includes the site management services. And we have attachments in our agenda packet tonight. Do I hear a motion from anyone?
Mr. Chairman, I move that we approve the recommendation as you read it from pages 136 and 137.
Thank you. Second. And we have a motion and a second. Is there any questions on the motion? Hearing none, we'll go to the vote. All those in favor signify by saying aye.
Aye.
All those opposed, likewise. Ayes have it, motion carries unanimously. And now we move on to the approval of the ROAP administration agreement with KARTS. And Ms. Kathy May and Mr. Randy Cantor. Who wants to go first?
Good evening. Everybody knows me, I hope, by now. I'm the director of KARTS, and I'm here to request from Granville County that the Rural Operating Assistance Program funds be directed to KARTS instead of to the county. We have already spoken with Vance. They've approved it. We have a knowledge that Franklin's going to approve it, and I'm at the Warren County meeting on Wednesday and expect it to be approved there as well. Let me run through it real quick. What is ROPE? ROPE is Rural Operating Assistance Program. It's offered through the state. There is no match for it, which is one nice thing. It covers three different elements of citizens trying to use public transportation. One is rural general public. The other is EMPL, is employment. Employment is anyone trying to get back and forth to work or to vocational training. EdTap is for the elderly disabled. Transportation Assistance Program, anyone 60 years of age or older or anyone with a verifiable disability can utilize these funds. And when I say utilize these funds, what I mean is there's still a fare to be paid. But if someone's trip cost $30 and they paid $4 for the fare, the other $26 is covered by this grant. Where are we going with this? Operational and administrative grants are applied for and reimbursed after the services have been completed. In other words, we have grants that once we've offered the trip, completed the trip, we put together a report, we send it to the state, we say these trips cost X number of dollars, and they write us a check. ROPE is different. ROPE, they front you the funds up front. All you have to do is report on the funds at that point to show their usage. Any funds not used, this is current. I don't want to confuse you, but this is for FY 25 going into 26. Any funds that are not used are subtracted from the next year's allotment with the current year's unspent portion rolled over to the next year. So let me explain. If they give you $100,000 in EdTap funds, you only show usage for $50,000. That other $50,000, the state feels like they've already given it to you. You have it. So in the next year's $100,000 allotment, they're only going to give you $50,000. So basically, you just lost $50,000 worth of services to your community. Next year, FY 26 going into 27, they're no longer rolling it in. What they're going to do is whatever you've reported on, and if you haven't shown the usage of these funds, those funds are going to go into a bucket and they're going to be dispersed through a second disbursement to other counties. So you literally are losing those money at this point. Currently, KARTS is responsible for the application process, the requested ROPE funds. Once approved, the funds are sent to the counties, which are then responsible for reporting the usage back to KARTS so that we can report it to the state. KARTS will then invoice each county for the RGP EMPL funds. We step up right at the beginning and say, go ahead and let us have the RGP and EMPL funds. EdTap funds have been left at the county's discretion in the past, but must be reported on in a timely manner. KARTS is required to report this information monthly, and any corrections must be made before a final approval. So if we submit something and we say, that's it, state stamps off on it, we can't back up and say, oh, wait a minute, we missed these 200 trips that we did at $10,000 or whatever it is. That doesn't work. They don't allow us to do that. So basically what I'm asking for is to, did I miss a slide? I did, didn't I? Sorry. To simplify the process, place all the responsibility on KARTS. We are requesting that KARTS become the direct recipient of all funds for all future ROPE allotments. With our new scheduling software, which I spoke about the last time I was here, it is in place now and it is working tremendously well. We can track county usage, cost, and closely report on time to the state. Let me show you an example of what this kind of sort of looks like. This is actual numbers. So if you look at this, you see the FY 25 allocation and you see what was carried over. So in 24, there was $6,000 that wasn't reported to us as far as usage. So it got rolled over, which means you lost $6,000. EMPL is always spent. You never have to worry about that one. EdTap There was $48,000 that was rolled over from last year. If we had spent it last year, we would have received $77,000 again, but we didn't. If you look over to the right, you'll see the balance. One thing I want to say about this too is this is missing May and June. We haven't put May and June's number into here. If you notice, we're already into the negative. $65,000 in the MPL. I expect that to be around $75,000 before it ends. Those trips were performed by KARTS without the expectation of being reimbursed for them. KARTS just ate $75,000 to help the citizens of this county get back and forth to work.
I got a question, sir. Why would we run a business, and that's what KARTS is a business, and allow people to use our business and not pay their portion when they are, it's not like they're going to the doctor. It's not like they're going to the dentist or the pharmacy or to get groceries. They are being carried to an employment place where they are making a paycheck.
Mm-hmm.
That's the question I have.
So your thought process is it should be, let's say we use the term fully allocated cost, meaning what did the trip really cost somebody? Most people couldn't afford it. I mean, if you were, let's say we picked up somebody, our fully allocated cost right now is around $2.50 a mile. Let's say somebody has to travel 10 miles, right? So $25 each way, that's $50 a day. A lot of people you can't afford that. So that's why the state gives us these funds to do that. The other thing about EdTap funds, I applied for an additional $500,000 in 5310 funds. 5310 is a federal grant, not a state grant, but it is only a 50-50 grant. So we're going to show the funds that we receive from ROPE as our 50% match. The state and the feds will allow us to do that. So we're hoping to have an extra $250,000 for that as well this next year, 26.
Mr. Chair, why did we not spend money that was available?
Reporting issues. It wasn't reported correctly. So actually, I don't think that, I'm going to give Kathy May grace because she's been a big proponent and a help to us. I don't think she was aware that the funds were there. I don't think the funds were in whatever bucket that EdTap was in for the county. I don't know. All I know is she wasn't, am I right? You weren't aware?
Yeah, there's only certain things you can use this money for. And it was really, more than what we needed last year. The year before, we didn't spend all of it because there were reporting issues with the former administration at KARTS.
Mm-hmm.
So anyway, this way, everything will go directly to KARTS and it will just be a smoother transition. 2/3 of this money, 2 out of the 3 are already going to them, but they have to go first to the finance office, then be dispersed to KARTS. The EdTap money is sent to senior services. And then we have to report to them monthly as the trips are provided.
So it's administratively better to ensure that we actually expend the money that we have.
It is.
Yes.
So my next question to you, sir, is based on the financial history of KARTS, what assurance can you give this board that should we do that we have no concerns?
Right now, KARTS is in a really good place financially. It wasn't where it was at 2 years ago before I got here. The other thing is with our new software, we can report down to the dime where every single dollar went. And part of the resolution that I'm about to ask you to pass is that we have to report to your county management every month while we're reporting to the state. So you can see where the funds are going to. KARTS cannot use these funds for any other purpose than assisting the citizens of this county with transportation.
So this is Miss May, help me with this, and I know I always ask you questions, and I always feel bad that you think I'm picking on you, but I'm not.
That's okay.
But this is separate from what about the funding for the 5310 funding for the Oxford route? Is that part of this?
No.
It's a separate matter, right?
Separate matter.
And so I guess my concern is that, I would want to make sure that money gets spent because did we leave money on the table if we could lose to help some people in the southern end? Based on your new software and tracking to see whether or not there's a need?
I'm misunderstanding the question.
Does your software, will that be able to indicate to you where the needs are in the county to increase services? Because we don't have any, other than the telephone call from KARTS, we don't have a route or anything like that in the southern end, which you're well aware of.
And yes, if we deny trips because we can't do it or we don't have the funds, which we've never done, as you can see, it tracks that, yes. I could go in and run a report.
We use this money to bring seniors in the southern end of the county into the senior centers.
Okay. We'll talk about the other routing stuff at another time, but I really would like an update on that because we're still looking for a means of a loop or some type of 5310 opportunity, even though one's allowed per county. From talking to some folks in DOT, there might be other opportunities, and we're really looking to, in that regards, looking to KARTS to take the way, and be glad to have further discussion with you about that.
I'm available anytime.
I'll talk to you, Mr. Z. Obviously, you're on that board.
All right. Are there any other questions?
Quick question, all the administrative will come out of the KARTS office now?
Yes.
Not from Ms. May, won't have to be responsible anymore?
No.
Okay, thank you.
Okay, does anyone else have any questions?
All right, this is a resolution. It's one sheet. I also have, and I'll leave this with Drew. I think I sent this to you. This is the actual legislative document stating that this can happen. We can make this work. An act to allow public transportation authority or regional public transportation authority to apply for elderly disabled transportation and assistance funds on behalf of the counties that the public transportation authority or regional system serves. That's actual legislation from the state of North Carolina. The actual resolution, this page, I'm going to read this top sentence, and that basically summarizes everything on this page, okay? But I need a resolution that states, for car area transportation authority to apply for, administer, and report on all funding associated with the North Carolina Department of Transportation's Rural Operating Assistance Program. Following resolution would be, and upon being to vote, is duly adopted.
May I ask one final question there, Mr. Gooch?
Drew, do you have it?
Everything that you sent is included in the agenda pack, and I don't see that resolution. There is a memorandum of understanding in there that covers a lot of the same.
It does. It does. Here. This is, I had it to you in the morning, but it says last sentence here. I'll fix that. That's the memorandum, but that's the resolution.
Sir, based on all the funding Granville County received last year along this lines, how much overall was returned unused?
Give me 1 second.
Is it in it?
Yeah.
Nothing was returned. They just didn't, whatever allocation we got for the next year.
Was reduced.
Right.
Do we know how much that was?
I don't know for 24, there was $48,000 rolled over from 24 into 25.
Okay.
I'm gonna ask a question so that I can understand maybe. It was not used, but it was not used because of an administrative situation or errors? Or is it not used because we didn't have citizens that called to use it?
There are only certain things that money can be used for, and we didn't have enough requests to use the entire amount.
But you have to use it for that specific
That's-
item. So we didn't really lose that money, it just wasn't request for the use of it.
That's
Okay, well,
correct.
that's a little different then. So we're not losing anything, we just didn't have the citizens didn't have the need for it.
That's correct.
Okay, that clarifies it then a little bit better.
With that said, Mrs. May, is there anything we can do better to make sure that, as a county, to make sure our citizens are aware of what's available for them to use? I mean, in other words, maybe.
Well, and honestly, CARTS can't always provide what people want, right? You know, it's more to the picture.
And it's also with, so when we got the new software, we had two options. One option was we could roll over all the data from the old software package into the new one. We decided not to do that. We went through and we inputted each and every individual that uses our system and their personal information into our system. So there might have been cases where we could have shown this person under this funding source, but the information wasn't in the system to show that, like a disability or something like that nature. We've cleared that up now. So in beginning of FY '26, July 1st, everybody's personal information, date of birth, because it's 60 or older, we have to show that that person's age is 60 or older. There were rarely any birth dates in the old system at all. We had no idea who would actually qualify for this. I think this year we're going to actually run out of money.
And to Commissioner May's comment, suggestion, it would be good, I guess you advertise that what is eligible, Kathy, does that make sense? That what people can use?
It's just a little bit more difficult than that because, like for one thing, we can reimburse volunteers through this funding. We have volunteers who carry out home-delivered meal routes. We can reimburse them for their mileage. That's one of the things we do. We don't always have to use the community transportation system. But if you've got somebody on Bruce Garner Road that now if they need medical transportation, CARTS can get them there. But if they need a trip to the grocery store on a certain date, it may not happen because CARTS just can't do it. There are just lots of cogs in the wheel.
One question I had on taking a quick look at the memorandum of understanding is it says that the county delegates to the authority the power to determine how the rope funds will be distributed within the county, including allocation of funds, management of the funds, administering the program, and filing of reports, et cetera. And then it says the authority serves multiple counties. The county agrees that the authority shall use the funds to provide transportation services to anyone living in the service area of the transit authority, regardless of that county of residence. Is that a change from how it's currently done? In other words, do the funds that Kathy's been getting go directly to this county? I'm sorry. You already know the answer.
Yes, the funds that Kathy's getting goes directly to this county.
But once you apply for the funds,
we will track the trips. We don't, like right now, we don't have enough trips to show that we're using the funds in this county. So we need to make sure that every trip in this county is captured to receive those funds.
But that's a record-keeping issue. What I'm asking is, will there be a difference in the services that would potentially be available to Granville County residents if it goes on a regional basis?
If other counties, towards the end of the year, if other counties haven't spent down their funding, I could move it to this county.
But you could also move it to their county if this county hadn't spent down its
Yeah, but
funds.
it's not, that won't happen. We have about 200 funding sources in our new software. We can track each and every trip by county and the cost of it and what funding source is it coming from. So once the person is placed into the system, they're assigned a funding source. Everything that they do from that point forward will come from that funding source. I understand where you're coming from, and I read that sentence also.
So why can't we amend that to say, excuse me, County Attorney, if you, my concern is why can't we amend that to say that not to utilize our funding without notification of this board and approval of the board?
I'm fine with that.
I guess I don't know where this memorandum comes from. If it comes from the state, it may be difficult to amend. So,
well, no, okay, let me rephrase that. The state gave it to me as a template. That's where the error at the bottom of the first page came from. They said, here, use this as a template to work this out. It's not from the state it's not, I don't know what I'm trying to say. It's not the state's record of a memorandum of understanding. It's just a template.
so it's not a state-created form, it's just an example of one another jurisdiction used?
Yes. So if you want to change that, yes, we can change it.
I just noticed it and thought it was something the board may be concerned about. I don't have a policy position on that.
I would not do that to begin with, but.
Would not do what?
Use your funds in somebody else's county.
I got that, but if we sign the agreement as the attorney just explained it, it could happen. And I understand, I trust you're a man of honor. I completely trust that, sir. But I think from my position is, as a board, is that we're receiving that funding for Granville County. I would want us, if it came to that point, to at least have some means of a trigger or a tripwire to notify us as to why and whether or not we would agree with that. That's all I'm saying.
And if you want to amend it to where it states that it'll only be, the funds that received for Granville County will only be used in Granville County.
That's something that we can look into. I mean, Jim's comment about whether the state template can be amended in that way, but we could certainly seek, sort of explore that option.
And I just want to say also that I will come back to you if this does not work. I will come back to you and ask you to undo this. That it right?
Yep. Thank you. Yeah, there's a clause in there for the county to say, no, we no longer want this in place.
And is this something that needs to be approved prior to the beginning of the fiscal year, or is it something that we could make revisions to the MOU, make sure we're all in agreement, and bring it back on for the decision at the July meeting?
Yes, we can come back in the July meeting.
And that wouldn't require you to come back. I would just suggest we maybe put it on the consent agenda after we've agreed on changes to address any issues of concern to the board.
I'm absolutely fine with that. Yeah.
Okay.
Okay.
Mr. Chairman, we need a motion for that.
I guess to make it official, we probably should.
Okay. I'll make a motion that we table it, and come back, have the county attorney review it, and then consult with Ms. May, or Randy, whoever we need to, and come back in our first meeting in July.
A second.
Okay, we have a motion and a second. Any discussion on the motion? All those in favor signify by saying aye. Aye. Unanimous. Ayes have it.
Thank you for what you're doing.
And thank you. And our next matter of business is county manager's report.
Nothing tonight, Mr. Chair.
All right. How about the county attorney's report? Would you have anything, Mr. Wren?
I've caused enough trouble. I'll be quiet.
That was last meeting. All right. Presentation. I'm getting a little punchy here. It's getting late. Presentation by board members. Commissioner Williford,
Just real quick, Commissioner Griffin and I went to Raleigh for the Advocacy Day. I don't even know what day it was. Wednesday. And Thursday. I only went one day. But it was good. We got to speak to one of our legislators and were able to meet with the NACO, and I thought it was well worth it with the networking and what we learned. That's all I have tonight.
Thank you. Commissioner Griffin.
Just to follow up on what Commissioner Williford said, I did attend the County Advocacy Days in Raleigh last week. The first day I got to meet with the Secretary of the State Auditor, Briner, a real intelligent young man that's doing a lot of things to help the retirement system of the state of North Carolina, has a lot of good ideas and is looking to change some things as far as that goes to help ensure that our retirees from the state of North Carolina, that their pensions are well looked after for many years to come. Secondly, I called to some of the residents of Deerfield subdivision today. As everybody remembers, they had a problem because they had a private road. They are getting ready to start the road repair. They've collected enough money in order to start the project and get that finished. I was able to go to a ribbon cutting at the Tar River Land Conservancy. I had never been to one of the Land Conservancy's trails before, but it's a beautiful place. Commissioner Karen was there and I was there. And it's really a beautiful place. It really is a way that we're going to help conserve some of our land and nature in Granville County. And I really applaud the work that the Tar River Land Conservancy is doing. So the last thing is through the County Extension Advisory Service, the Chancellor from North Carolina A&T is coming tomorrow. He's going to do a 5-county tour. If you're interested in coming, he will be at the Richard Thornton Library tomorrow morning at 9:30. I'll be there. I don't know how much of the tour I'm going on, but he's going to be here to explore some of the things that are going on in Granville County, and I really look forward to seeing him and meeting him there. Thank you.
Thank you, Commissioner Griffin. Commissioner Cozart.
Thank you so much, Mr. Chairman. Just like to say how good it was to be in Butner for the festival. It used to be called Pig Picking. The Human Relations Commission had a table there. Got to see a lot of people in Southern End. And I tell you, nice turnout, I thought, and just a wonderful time of sharing and all the different vendors. It was just a real nice experience to be there in Butner. I too look forward to joining the Chancellor tomorrow morning and being there at the library. We're having a number of outgrowth issues in our community related to homeless kinds of things, and I won't go into any detail tonight, but I used to think of this as issues that were prevalent in larger cities, and it's really kind of mind-boggling to see the level of homelessness we have right here in our area. So I'm sure we'll be hearing more about it. And also this coming Saturday, the Central Children's Home will have their annual day, and it normally is a very grand occasion. So I look forward to being there. Thank you, Mr. Chairman.
Thank you, Commissioner Cozart. Commissioner May.
Well, Board, I apologize for my absence over the last week and a half due to illness. I appreciate everyone keeping me informed. Good to be back. I look forward to going on Thursday to Johnson County to be part of Congressman Brad Knott's DOT Transportation Task Force. As you know, transportation is a key component. Mr. Williford, the item at the airport will be something that will be discussed along with some matters that the county manager is working on with the Secretary of Transportation to further our ability to make the appropriate steps forward in Granville County that's necessary. Our secondary roads are not 4-laned. Our primary roads are not 4-laned. The only 4-lane roads we have is the loop. And I talk about this often on this board because I want the public to be aware that this board is deeply engaged on how we're going to meet the growing demand, and that it's we do everything we can within planning that we can do to help with that, and making sure that they get the right TIAs, making sure that we have the right turning lanes. DOT does their due diligence, challenging DOT when we believe that due diligence is not sufficient. But now working with DOT to see how they can start meeting the needs of rural counties that are in a similar situation that we are in. So I look forward to that. And finally, I was really proud to be a member of the United States Army. I know Commissioner Kieran is a proud member of a veteran of the United States Army. It's one of the highlights of my life to serve my nation in an armed forces uniform. And so I was really happy to see the 250th anniversary of our military, of our United States Army, and that celebration. I appreciate the men and women over the history of our country since 1775 who've made the ultimate sacrifice for our nation in uniform and service to their citizens. If you recall, it was the Citizens Army, and the motto of the Army is "This we'll defend." And so, Commissioners, I thank you for allowing me to speak about that because it holds a dear place in my heart because my dad's retired Sergeant Major and able to travel the world while he was in the United States Army and see the might and the brilliance and the service attitudes of our soldiers. So I pray that God looks over each of them, and I thank you.
Thank you, Commissioner May. Commissioner Karen.
Thank you for Commissioner May reminding me on the 150th anniversary of the United States Army. That's outstanding. Hoorah, I guess is what they say nowadays. It wasn't a saying when I was in, but anyways, we didn't have MRAPs either. But so I'm glad Commissioner Griffin mentioned the ribbon cutting for the Tar River Land Conservancy. This is their 5th trail that they opened last week on Friday with the Pitcher Branch Creek Trail and Stem, which brings the total mileage of off-road trail to 15, minus about 0.2. You've got the Robertson Creek outfall in Creedmoor, the Ledge Creek Trail on both sides in Stem, and then the Horseshoe Road Trail in the southern end, which is Smith Creek. So obviously creeks are pretty important, and the trails run along them. So if you happen to have a creek in your property and you would like to conserve it for future generations, please reach out to the Tar River Land Conservancy. I'm sure they'd be willing to accept a donation or a easement on that waterway. So one other thing that was interesting in the last couple of weeks was the Ripe for Revival, which is a traveling food truck brought to us from Rocky Mount through the Cooperative Extension on a grant that Wendy Tatum has procured. An outstanding agent with the Cooperative Extension here in Granville County. So I'm excited about those continuing efforts on that front. But, coming up, I know we've got Juneteenth coming up this Thursday, federal holiday and all that kind of fun stuff. Banker holiday, I guess is what it is. But, there's a reason behind that. And I think people would be well to research that. So with that, I have no other report. Thank you very much.
Thank you, Commissioner Karen. Commissioner Jay.
Just one. I just want to let Commissioner Karen, Commissioner May know I was at the ribbon cutting of the urgent care last Thursday.
Thank you, sir.
And I spoke up for you.
Thank you. I appreciate that. I've always been there.
Because the first person that asked me said, "Oh, you passed Tar River." I just want to let y'all know that I did go and represent the county. And I
Appreciate that, and I hope you noticed the sky was just a little bit bluer.
come to find out that the people that are running it, it's the people that I really, really know from Preston County.
Thank you, Commissioner Jay. And by going last, everybody's covered everything, so I appreciate it. And I want to thank all of our commissioners here, you for the excellent job you do, and diving into subjects instead of taking them at face value. Thank you all. And with that, is there any other matters that need to come before us tonight? We do have a matter for, a personnel matter for closed session.
And one for attorney-client privilege, I think, and also economic development.
Okay, gentlemen, we're gonna be here to midnight. Yeah, let's entertain a motion to go into closed session with a 10-minute break in between.
I'll make a motion.
We have a motion. Do we have a second? All right. All those in favor? All those opposed? We're in recess. We'll reconvene in 10 minutes in closed session. Thank you all. And thank everyone for coming tonight. We appreciate you being here.